How's it going, everybody? Welcome to the second episode of Recovery Recap. I'm here with one of my patients, Frayda, and she's going to tell us about her story as far as injuries and then her journey of recovery. So why don't you tell us why you first came to me?
I was at the point in my life where I couldn't sit or walk or do anything without being in pain. As I told you when you walked in, the chair I'm on is part of the story because I was at the point where I was getting a pillow for every chair, just hoping to be able to sit comfortably. And at that point, I was going to a chiropractor, a great chiropractor. He wasn't helping. And I kind of thought, oh my God, is this what my life is going to be? And then my husband, who goes to a gym, came home and he said, everybody at the gym is talking about this guy who they call the voodoo doctor. I'm like, voodoo doctor? Anyway, I was at such a state that I'm like, I have to go. I can't just live my life in pain and complaining every day. And I went to you, and you're like, let me see you stand, let me see you do this. And I'm not going to say I remember everything you did or everything you taught me. I only know that within 2 weeks I was no longer in pain. And I continued to see you. We continued to develop. You gave me exercises, which I do religiously.
Great.
And that's a huge part of it. I've like, you don't know, every day I'm like, I have to go do my Eric exercises. But I am virtually pain free. And I also feel I'm 72 years old. And I think about the way I walk and the way I move. And I can see I walk and move in a way that mostly younger people do. I look at a lot of older people and they're stiff and they're in pain. And I only wish I could get them to go see you. It's sometimes it's tough to get people to make this change. But I always tell them it is so worth it because you can you can play with your grandkids in a way you want to play with your grandkids if you get yourself moving as you help me get myself doing.
Yeah. And I think one of the big shifts that you had was because I think what you noticed about a lot of my exercises is their subtlety.
Oh, yeah.
Right? And I think that was a difficulty of how, like, you weren't sure of how much are you picking up on the subtleties of the exercises. And I think one of the main goals I have for my patients is to realize that they move in goals in the first place, right? Like, if I want to grab this bottle, right, my muscles are going to listen to whatever my nervous system says is going to be the best strategy to grab the bottle. So I think there's almost this feeling of you don't have to worry about what muscles turning on, or like I'll never tell somebody, oh, engage this muscle more, right? The reason why is because you don't have that kind of control. You have the control of how much concentration do you put on this one joint. And I think that was when you started to think that way, I think the exercises became a lot clearer.
I'll tell you something even more. I feel my ability to concentrate has improved since I do these exercises
Really?
because I always think I have to force myself to concentrate. And that, of course, folds over to other things we do, like we play ping pong.
Mm-hmm.
And sometimes I'll do some of your exercises before I play ping pong because it forces me to concentrate on getting my body aligned, on thinking about my body, but it's the concentration.
Yeah. Oh, absolutely. I think when somebody realizes that their coordination increases, the slower, like I always say, this is, I think it's an Air Force mantra, but slow is smooth and smooth is
Hmm.
fast, is that when you take one action and you slow it down, you have more time to delegate to that action. So it allows you to all of a sudden have so much more coordination. And then once you've practiced the right coordination, it just becomes second nature and you
Hmm.
stop thinking about it.
Well, on that, I haven't stopped thinking about it because one of the best suggestions I got from you was when I said to you once, well, how should I walk? And you said to me, walk softly.
Yeah.
And that's huge because walking softly does take more concentration. I
Hmm.
have to control my muscles. I can't just plop them down.
Yeah.
And it makes, again, I think that's one of the many reasons, the exercises and that again, I am almost pain free all the time.
Yeah. Oh yeah, because walking softly is there's not one thing you have to do. It's almost like it's a measurement that
Mhm.
you're taking at all times, and you have to make sure that that doesn't spike. Because one of the reasons why people's joints are in pain or they get overloaded is because there's a lot of impact to walking or to running, and what people are looking at with trying to get better shoes and trying to fix the way that they their gait, all these different
Mhm.
things. One of the things they're trying to really do is to reduce the impact on any given joint,
Mhm.
right? And there's a reason why we evolved with so many joints between our feet and our head is because it can distribute. And when you're properly distributing, that's actually what you're doing when you're trying to. I always tell patients to walk with earbud or earplugs in their ears, because what happens is that through the air, you're hearing all of these different noises that are going on around us, right? But that's called air conduction hearing, right? And then there's bone conduction hearing, and you don't notice that as much because it's kind of in the background all the time. But if you block out the air conduction hearing, all as you hear is the bone conduction hearing. So you
Oh,
hear
wow. Interesting.
really hard these thud,
Oh my
thud,
God, that's
thud.
interesting. Wow.
Yeah.
Wow.
So when they do that, they go, "Whoa! Like I'm really putting a lot of weight and putting a lot of like force
Hmm.
into this." And when they walk quietly, it's almost like you don't know what you did. Like I don't know if you can pinpoint like what you changed about your gait when you started walking quietly.
I think I controlled it more. I
Yeah.
stopped, like I said, I stopped flopping my feet down without
Mm-hmm.
thinking about it.
Yeah.
It made me walk softer, like you said, and that put a lot less um, damage
Mm-hmm.
on my joints.
Oh yeah. That's great. And I have to say, your goal, like of like being able to play with grandkids and all these things, that is like one of my favorite goals for someone to have, because it's just like walking quietly. It's like what one thing do you do so that you could do that? It's hard to say,
Hmm.
right? It's almost like you got to change your lifestyle around, and then all of a sudden it just becomes conducive to being able to do that. Being able to pick them up or do whatever you want. Like that. There's not one thing. I can't tell you to do one exercise to that. It's
Hmm.
like a changing of the way you see your body.
Well, it's about having your body be a lot less stiff.
Mm-hmm.
Um, Look, there's no question. A 70-year-old body is very, very different than an 8-year-old body.
Mm-hmm.
But still, at least I can catch the ball. I can run a little bit.
Yeah. Oh, being above 70 and being able to run.
Well, not exactly running. Let's not go too far. I mean, not compared to them. But let's go back to the
Sure,
exercises.
sure.
And you're right. It's a bit intimidating when you give the exercises and you explain how specific it has to be.
Mm-hmm.
And that was really hard at the beginning because I remember so many times thinking, there's just no way I'm going to be able to do what he's telling me I should do.
Mm.
And I can tell you now, I do all of that without much effort.
Sure.
And I look back and I go, oh my, did I really say I wouldn't be able to bend my hips like that?
Yep.
But I did. I remember thinking, he's
Sure.
got to be out of his mind. I'm not going to be able to do that. And now I do it every day.
Yeah. I think the hips they're a funny joint because a lot of the goals that can be accomplished using the hips as the primary mover can be done by using the knees as the primary
Mm.
mover or the back as the primary mover. And those aren't optimal because the muscles around them are not as strong as the muscles around the hip.
Mm.
And I think when you a lot of my exercises, like, they look robotic because I'm trying to isolate the hip, right? Is if you're moving your knees and your backs too much, it's like, not as if you shouldn't be able to move multiple joints at the same time, but there's a proof of concept. You should be able to move your hip alone, right? And when
Mhm.
people can't isolate their hip, they go, this must be a movement you can't do. This must be a thing that humans can't do,
Oh,
you know?
right,
And then
right.
all of a sudden I'm like, do it on the other side. And then they're like, all right, I can do it on this side. I'm like, why can't you do it on that side?
Hmm.
Because your body doesn't trust you. Your nervous system doesn't trust that that joint can move through those ranges. And then that's what the point of the exercises are. And that's why they need to be kind of particular. Because I don't want you to bend to the right in any old fashion. I want you to bend to the right using your hip.
Yeah, yeah. No, obviously that's really important because one of the things I've also learned from you is the muscle that hurts is not necessarily the muscle causing the problems.
Mm-hmm.
That muscle hurts because it's compensating
Yeah.
for the problem.
Mm-hmm.
And I think a lot of us will do an exercise to fix the muscle that
Mm-hmm.
hurts, and that's not fixing the problem.
No. Yeah, there's a good analogy. I don't know who came up with the analogy, but they talked about mopping up a puddle on the floor and then going the next day and seeing the
Oh,
puddle
right.
come right
Yeah,
back,
yeah,
right?
yeah, right.
And
Because they didn't fix the leak.
they didn't fix the leak on the ceiling.
Yeah,
And
yeah.
that's I always say this is what, when I started thinking about all pains or any problems as two different things. There's things that are caused by tissue damage, right? Inflammation, stuff
Mm.
like that, you would signal tissue damage. And then there's blood flow problems, right? And blood flow problems, you might say, like, oh, well, what about, like, there's like, what if you don't have the right motor control or the right flexibility or mobility? And fundamentally, those are blood flow problems, right? Is that this is something that early on I've taken a few continuing education courses,
Mm.
and they make you feel as if you have to, like, teach the body how to work again, right? And that's a big responsibility, right? To think that you have to teach the body what's right, and how do you know what's right, even for that person? But over the years of my practice, I've realized that that's absolutely not true. That your body knows what to do, right? You have to get out of your own way.
Hmm.
And that's where getting some proper blood flow to the muscles that need to be
But
have the
also,
blood.
it's about unlocking muscles that have tightened up
Right.
and letting those muscles function again.
Yes. Yeah. So when a muscle's braced, right,
They're locked.
it's locked, right? And the thing is that you don't
It's
have
no
good blood
longer
flow.
functioning then,
Exactly.
essentially.
It doesn't allow it to relax because it needs to
Mhm.
fire again, right? And I call it the vicious cycle of tension. Is why did the muscle lock? Probably because you overloaded it, right?
Mhm.
You probably either overstretched it or you did it too many times or with too much weight, and it tried to protect itself by staying short. And then you might go, oh, well, how does it get better? And you go, oh, relax. It's like, it's not going to relax.
Right, right. Yeah.
Why isn't it going to relax? Because you don't know how to work it properly. You don't know how to control
Release
it.
it.
Exactly. And if you just go and release it, it's no better because then it might go get damaged again. So there's this vicious cycle of it's not getting blood flow, it's not repairing. And how would it repair? It probably needs to be used again, but it won't get used. And it goes around in this circle. And what happens is, like, there's this shift over from your therapist, your physical therapist, your acupuncturist, of them treating you, right? There's this idea of,
Mhm.
like, a treatment being applied to you versus a, a a shift of awareness that you have that they're teaching you, right? And then when they teach you, you can continue to do that. And really, what a therapist should do is take you out of your own way, right? Is that when you're a lot of times people, especially with the diaphragm, right? People brace their diaphragm, and people ask me, why is that tight? I'm like, you want to know the real reason? You're holding it tight. And they go, no, I'm not. I would let it go. I'm like, you would, but you
So
don't know
what do
how
you
to
do
let
to
it
get
go.
them to let it go?
Exactly. You have to find a goal, right? That's why there's such a power to speaking to a patient and getting their trust and having them understand that it's through the visualization of a goal, right? I have to visualize what my hand looks like around this in order for my muscles to properly get engaged to do that. I have to visualize what it would feel like for my diaphragm to be relaxed.
Well, I have to be honest. I don't think I visualized anything, in all honesty.
Sure.
And I'm not quite sure what you did to help me release the muscles that were tense. It was, I think, the exercises. Eh, I don't. I don't think there was this visualization.
But the thing is that when I tell you a command within an exercise, right? What I'm actually asking you is your body is in a position that needs to be in a different position,
Mm-hmm.
right? So what you do, and whether you like see the visualization in your head, but what you hear is he's giving me a command, and that's where there's such a trust of like when you trust that, okay, if I'm in this position that he's asking me to be, what will happen is that muscle has to load, and like it doesn't, I don't trust it to load, but he's saying I can do this. And when all these other variables are taken out and that's the only thing you have to do, you start to get that muscle, I call it back online, right?
Mm-hmm.
Is that the muscle is back in the toolbox for you to start using again. And that's what I mean by the visualization, is that like you need to have specific descriptive goals. And when you have those goals, and that's what the exercises fundamentally are, is that they're goals for you to utilize in order to put that muscle back in your wheelhouse and back in the toolbox to be used.
Okay, you say goals, I say exercise.
Yeah,
Let
yeah,
me be
yeah.
honest. To me, they're just exercises,
Sure.
and I do them. And to be honest, I still wake up stiff in the morning, but then I do go through your exercises, and my body loosens up,
Mm-hmm.
and I'm able to move again.
Yeah.
I mean, some mornings more stiff than less, but I mean, you've given us some good, really good exercises that gently loosen that
Mm-hmm.
stiffening in the morning.
Yeah.
And for old people, that's a huge deal.
Yeah.
Huge. It's the roll you do, the
The rolling
pull,
kind.
yeah.
Yeah.
And both my husband and I do it.
Yeah.
So
Oh,
for
I'm
me,
so
again,
happy to
it's
hear
yeah,
that.
yeah. For me, it's so okay. What else do we?
Yeah, no, that's
Oh, okay.
great. Excellent. No,
Yeah,
that
I
was
think we area up
perfect.
good. Yeah.
Yeah, absolutely.
Okay.
Thank you so much for coming on.
I'm glad. I'm glad.
Yeah.
Oh, the one thing I will say is it drives me crazy when people say they're going to get back surgery.
Yeah.
My sister's a chiropractor,
Mm-hmm.
so she long ago warned me against it.
Mm-hmm.
But, I just try and urge anyone, look, you have a choice. You can try and use a natural solution. That worst comes to worst, it won't work, but you
Mm-hmm.
haven't put yourself in any danger.
Yeah.
But
Yeah.
you go for back surgery, you're putting yourself in a lot of danger.
Yeah.
And often they do things that lock your back in, not
Yeah.
let you move
Mm-hmm.
more naturally.
It's damage
It's
control. Yeah.
that, but it's just crazy to me that people won't try and work through the natural solution that lets your body
Yeah.
solve
That's
the
a huge
problem.
thing.
And yet, so many people, and everybody will say, no, 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 I know that. It's just my situation really requires
Yes.
the back surgery or the
Mm-hmm.
knee surgery. And then I see them months later, and guess what? They're not really much better off.
No, no. And you know what happens is a lot of times they feel better for a while, but the
They
causative
haven't, that's
factor.
right. They have not resolved the fundamental problem
Yep.
that caused them to not walk, to have the
Yep.
knee problem or whatever.
Mm-hmm. I always think when somebody has like they're a candidate for back surgery in general, and if I watch them move their back, and some people don't really understand what their back looks like, you
Mm.
know, that you have 24 independent vertebrae, not to mention the sacrum and the coccyx are fused, right? Um, you have a lot of vertebra in there, and each vertebra, when it's against another vertebra, is supposed to move. And I think people just think, oh, there's a bunch of bones in your back. It's like, but every segment is supposed to move, right? And if you can't move intersegmentally, like control one at a time, right? Everyone can just bend in these big, gross movements, right? But if you can't do that and you've never tried, you have no clue how much improvement you can start to
Mm-hmm.
make if you start moving intersegmentally. And that's where it's like, I always say a surgeon usually will give you a prediction or a likelihood of how likely you need the surgery based on the person that's going to do the least. You know, like a person that like plans on doing no conservative care, no exercising, no rehabilitation at all prior to yeah, that person probably needs a surgery. You know, but the person that's gonna actually do something, you have no clue. You can't limit what's
Right.
possible with them.
Right. And anyway, it's about taking control of yourself.
It is.
Okay.
Yeah.
Good.
Frayda, thank you so much
Okay,
for
thank you.
coming
Yeah, well, I
on.
appreciate it. I'm
Yeah.
always advocating for people to go and see you, and I know those who have, like my friend
Mm-hmm.
Christina from Arizona,
Yeah.
who came here to see you,
Yes, she did. That's
and
amazing.
she was thrilled.
Good,
Yeah,
good. Yeah. Oh, she is a good patient.
yeah.
Absolutely. Thank you for sending it to me.
Okay, thanks.
Yes. All right. And I guess we'll close up here.
Yep.